further ado, I am happy to bring to you my friend, Amy Boyd. How are you doing, Amy?
I feel good tonight.
Awesome. I'm so glad to hear that. I know we spoke yesterday and you were tired.
Oh man, I had that second dose of the COVID vaccine last week, and it just it put me on my backside.
I hear you, girl. I hear you. Well, for those who are watching right now, Amy has been on our show a couple of times. The first time you were on was back at our triple negative breast cancer broadcast in 2019. You were also a guest on the Beat broadcast, which is every Wednesday at 7 p.m. Central Time here on the Breast Cancer Can Stick It Facebook page. You were on back in November for that, and you've continued to keep us updated. But there's many people, Amy, that haven't met you that are watching right now. So I would love it if you could take us back to the very beginning and let everyone know how you found out you had triple negative breast cancer.
Okay, so I first found out I had cancer because I have a history of dense breast tissue and cysts. It's something that it happens in my family, and I had something that was bothering me, and finally it got bigger than what I felt like it should have been. You know, generally a cyst, maybe like the size of a quarter or something. This got bigger. I went and I got a mammogram, and they immediately sent me for a sonogram and a biopsy. And turns out it was stage 3 triple negative breast cancer.
Wow. So terrifying to get
Very
that.
scary
Yeah.
diagnosis.
I mean, well,
Mhm.
and like we were talking with Dr. O just now, just a diagnosis alone of triple negative breast cancer can be really scary. And then when she goes into the details about the difference between stage 1 diagnosis and stage 2 and stage 3, it's definitely a scary thing. At that point, you started some treatments and had some surgeries. Let everybody know what you did.
Yes, so they did chemo first for me, and right now they're still doing the typical, adriamycin, Cytoxan, and then they moved to Taxol and carboplatin as your second. They give you a break in between because you can't actually have all those medicines in your system at the same time. So that was about 16 treatments. Then I had my surgery. Then I started the Xeloda, which is the oral medication. You take that twice a day. I was also prescribed radiation. So I had 5 weeks of radiation. And then, I had this little like period where, you hang out for a while. You're like, oh, waiting for the shoe to drop. And I was actually feeling pretty good. I am a very active person. Before all the cancer diagnosis, I was on a roller derby team. I ran 2 races a month. I mean, probably any doctor's wish for a patient that would, just exercise. So my oncologist at the time sent me, okay, we're going to do your scan now, just to make sure. And it came back something in my lungs. Like, you've got to be kidding me. I literally ran a 5K 2 days before they found suspicious tissue in my lungs. So I went for another scan, and it's a PET scan, and it lit up, which means I probably had a tumor. So immediately I was probably cancer free for about 5 months. It came back pretty quick. So I went back to my oncologist and started the standard of care. And you had a great question asking what standard of care was. And I was on that chemo medication for 2 months. And my cancer actually got bigger, which is not good. So we my mom and I kind of went back to the drawing board. And I mean, I've known you forever. I've known you, gosh, what, like 25 years?
Yeah, I'd say probably about 20, 25 years. Yeah.
And I was like, April, what am I gonna do? I gotta see Dr. O'Shaughnessy. I gotta go see the wizard. And she met with me, and she actually said she had a clinical trial that she thought that I would be really good for. And this clinical trial is sort of a new approach to treating metastatic cancer, where a lot of times metastatic cancer gets that way because it's just chemo resistant. And that was what my experience was. Getting back on chemo was just, it wasn't working. It was just like ignoring the chemo, basically. So there was a pill that has not been FDA approved yet, but I took the pill for 2 months. And I think the last time I spoke with you guys, I was getting ready to start that. So I took this, well, Dr. O'Shaughnessy probably knows the proper term for it, but it sort of blocks a pathway, kind of like she was talking in the immunotherapy. It kind of blocks the pathway for the cancer to proliferate. This is a different one. So there's all sorts of different, with triple negative breast cancer, escape rates it has to kind of like get worse. And my particular genomic makeup of my cancer has this particular thing called a PI3K marker. And they, you hear a lot of things about genetic testing in cancer. So there's two words, there's genetic and there's genomic. The genetic testing is when they send you, when you first find out you have cancer and they want to find out if you have a gene like the BRCA1, BRCA2, that's your makeup. But the genomic makeup is the actual DNA of the cancer you have. So Dr. O'Shaughnessy did a really good review of the different markers of the genomic makeup of my cancer to match me with this clinical trial.
I'm so glad you just explained that so concisely, Amy, because that's so important for people when they're hearing terms being thrown around and whatnot. That's really good to know. But continue on, yeah.
So I took this pill for 2 months, and you kind of just have to trust the process. Then they start reintroducing the actual intravenous chemo again. And so this second step is the one I'm on now. I completed the first step, and I seemed like I was a good candidate for that. It's hard to tell if it's working until you then go to like the second and third steps. So I'm on a second investigational drug now. It was a drug previously used, I believe, for ovarian cancer, but they're seeing some promising results with it in other types of cancer now. And so I've been on that medication for 2 months as well. But Dr. O'Shaughnessy I'm a person that works with data as my regular job. Well, I like Dr. O'Shaughnessy because she is also a data geek. After my first treatment of this investigational intravenous chemo, which is the chemo that they put into your chemo port, into your blood, you don't take it by mouth. I showed a response. And I've been for another scan since then. And I am finally responding to chemo. So yay.
I know, it like makes me want to cry just to hear you say it. I mean, I know we've been talking about it through text messaging and whatnot, but it's just like it's so miraculous how they're coming along with all these different treatments and things for someone like in your case, metastatic triple negative breast cancer, and to have a response is like the dream,
I mean, it's almost you're always going to get kind of a mixed bag of results. Maybe some of the tumors respond, but some don't. But we had we showed at least a couple of the tumors had resolved, and I've never heard anyone say that to me before. So I was very thankful for that. I feel good. I'm actually able to tolerate this chemo quite well. I have to do the injections to keep my white blood cell count up, but I was able to, do chemo and get the vaccine. And I'm eating normally. I'm still exercising when I can. I'm still allowed to roller skate. I
That's
did give up
awesome.
roller skating for Lent though. So
That's so
I'm
cool.
gonna have to wait to get back on my skates. But I'm walking my dog. I'm eating 3 meals a day, which if you're a stage 4 cancer patient and you're eating, pretty much whatever you want. Dr. O'Shaughnessy has a diet she likes you to follow. So I'm trying to listen to her guidelines as far as that's concerned and not eat so much junk food and sugar. And, but, I've got a healthy appetite. I haven't lost any weight.
That's
So,
amazing. A lot of people either lose or gain weight through chemo. I remember for me, like the steroids, I remember gaining weight from the
oh
steroids that
yeah.
I just had this like puffy face all the time, it seemed like. So that
You get the
yeah.
moon face.
Yeah, you're like, "Hey, what's up?" But wow,
Mhm.
that's so good. So you're how often are you going in right now and having treatments?
I go every 2 weeks for treatment. I'm having that love-hate relationship with the steroids as well. I actually really hate them. Um, they keep me up at night and then I'm grumpy the next day. So I think you caught me yesterday after I finally got some
Yeah,
sleep.
you're like, "Hey, April, I'm alive for a moment just to talk." But yeah, yeah, you finally did get some rest. I was so glad that you did. So you're going every 2 weeks, and when do they check in again to see how things are going?
So the standard of care with most cancer treatment is they like to scan you every 3 months to check and make sure your treatment's working. Dr. O'Shaughnessy is really adamant that she wants it at least every 2 months because she wants to know sooner rather than later if something's not working. Because as she mentioned with the metastatic triple negative breast cancer, some of the women only have like a life expectancy of 18 months. So in that sense, knowing a month earlier, it could mean the difference in, finding a drug that works and one that doesn't. So I'm okay with that.
Yeah, yeah, totally, totally.
And the future for me as far as treatment, she talked at the beginning of her interview about the latest with immunotherapy and mixing it with other chemo medicines, even with people that are PD-L1 negative. And for people that don't understand cancer treatment, PD-L1 is one of those escape routes, one of those pathways that currently the insurance companies want you to have in order to get approved to use the medication. Dr. O'Shaughnessy has been doing clinical trials with people who are PD-L1 negative and actually getting some results. So what this clinical trial I've been on is sort of a preparation for, is to get me on the immunotherapy drugs that will be beneficial to me now that my cancer has started responding.
What kind of timeline? I mean, has she given you some sort of a timeline? Is it like the way I kind of look at it when I hear from you is it seems like they do this one thing and then they do it until something changes at this point, and then once it changes at this point, then they do that until it hits another point. Is it like that, or is it something where it's like, no, you do this for 4 months and then you're gonna switch to this?
So preliminarily, I was given that I would stay on this. Currently, I'm on step 2. I was told I would stay on it for 2 months. Dr. Shaughnessy was actually pleased with my previous scan results, so we are staying here right now. We're in a holding pattern. And since I'm tolerating this chemo well, I'm fine with that. Her staff is amazing. Some people are wary of becoming a clinical research subject. My experience as a lab rat has been I receive much better care because I'm watched more closely. I have a nurse I can text if I need anything at all. Like if I get a cold, I can text my nurse. I don't have to, go to my regular doctor and wait with everybody in the waiting room. I can, let them know I'm experiencing some symptoms and they find a way to help me. Uh, so what I'm understanding now is that I will be here maybe not too long, because she's already, working on my next, you have to get drugs approved from insurance ahead of time. So she's working on that already, so that whenever it's time to go to the next step, we don't have to wait. We're not stuck without treatment for
Yeah,
many.
like hung up with some red tape or something.
Yeah, and I've experienced a lot of that, especially with the scans. They don't like to approve those.
Now, are they the PET scans every 3 months that you're having when you have the scans?
So I'm a bit of a special case. They not always is it a PET scan. They typically have been CT scans for me. There have been times when my doctors have wanted me to get MRIs, but I was actually diagnosed stage 4 before they could finish my reconstruction. So some women that go through reconstruction, they have what are called tissue expanders in their chest. And when you go through the surgery, they slowly inflate the tissue expanders to get you to the size that you were before, because your tissue shrinks up, especially if you went through radiation. Well, these tissue expanders have metal in them, and that keeps you from getting an MRI. And they especially like MRIs so that they can keep track of what's going on in your brain and in different areas. So I'm relegated just to doing mostly CT scans. Every once in a while, like if they think they see cancer somewhere new, they will order a PET scan, and then the fight is on for them to get that approved. So I have put my trust and faith in her office because they've always been successful. So
Yeah,
um,
that's good. Yeah. So you still haven't had your full reconstruction at this point right now?
no, I did get to talk to Dr. O'Shaughnessy about that with my last, not my last appointment, but the one before. And her hope is that I can get a prolonged remission so that we can go ahead and finish this, at least get the tissue expanders out so that I can get an MRI. Um,
Yeah, no doubt. I
her
because
opinion is that it's easy for me to heal from that surgery. So I'm hopeful that I can go ahead and get that finished. These things are not comfortable. They are not like your typical implant. They are very firm. It's like literally like having some cantaloupes in my chest.
oh
They're
no.
hard. Or
Yeah.
like maybe if you've been a nursing mom and it's time to feed your baby, yeah, that's what it feels like.
Well, see, and I have no idea like of any of that, like what the shape of expanders are, how big they are. So it's just kind of like a placeholder, is it not?
Mhm. Yeah. Um, Too bad. I didn't think to. I have a picture of them from a CT scan. You can actually see them in the CT scan, and I look like an android kind of. There's like these robot parts inside my boobs.
That's so crazy. I mean, I don't know what I thought they were or what I thought they were like. It just never occurred to me like how it worked. And is there some cutoff date that they get concerned? They're like, okay, guys, she's had these expanders in for X amount of time, and that's just too long. We got to take them out.
If I were to get an infection, they would go ahead and take them out probably. It really depends on the patient. I asked my plastic surgeon, how long can I leave these in here? And they're like, he just said they're not meant to stay in indefinitely. Um, so maybe we can update you guys on that.
Yeah,
That's what to do.
that'll be the next update. Is where are we on your boobs, Amy? We'll be like, we need a boob update, please. Because that's not what we normally talk about, and it's interesting. I mean, is there any point where you'd be just like, screw it, I don't care anymore? I guess it would have to get really bad for that to be your option. But even at that, you can't have any surgery. Like you're kind of at a point where they don't really want you to have a surgery. Is that right?
A lot of people don't want to operate on people with active cancer. It's just not a good idea.
Yeah.
There would have to be some other problem that's causing me, like it blocked off some blood flow or something.
Right.
Right now I'm not in constant pain. It's preventing the MRI. Sometimes like if I roll over at night, it's uncomfortable, but I don't have to wear a bra like that.
It's like, yeah, gotcha. So no bra and just a little bit of discomfort, but no like risk really. It's just they're not meant to be in as long. So how long have you had them in at this point?
Had them about a year and a half.
Wow. And what was the original plan? How long were you originally supposed to have them in for?
I was I was diagnosed with stage 4 literally like a month before I was supposed to have them out.
That's crazy. What was
Mhm.
that diagnosis date for your stage 4?
I want to say it was June 30th.
Last year, right?
Yeah.
Yeah. Yeah. Crazy. I mean, what a whirlwind all of this has been. When you look back on it, what's been kind of like the worst part of it, other than the emotional turmoil, like the physical worst part that you've had to contend with?
Hmm. So my first chemo that I went through, the Red Devil chemo, was just, oh, it was miserable. I couldn't eat for 5 days straight. I lost 30 pounds. It was bad. um I mean,
The Nalesta shot, when you get that, you still have to get that. You were saying, I think, or you,
yeah, I get the little pod. So I used to have to go up to the hospital like you did and get it
yeah,
in my stomach, but now they have the little pod. I never really had problems with that shot. I know
that's
some
really
people
cool.
do. I'm
Yeah,
thankful for that.
yeah, I think it was Courtney that said that she had a hard time with that as well. Like for me, it was just, yeah, it was just horrible, horrible joint and bone pain, just really super bad. So I'm glad you didn't have to deal with that. But wow, so we're still on this train with you, and we're always going to keep, checking in to see how you're doing. And, I have such confidence that you are under the best care humanly possible right now.
Absolutely.
Dr. O is amazing, and this isn't like an infomercial for her. I'm starting to feel like it is, but it's truly not. This is just the reality of it for me.
Hmm.
When I met her in 2010, I knew that she was something special. Not to get too far off topic, but you know, whenever I got diagnosed with triple negative breast cancer, I didn't know what to do, and I had three different kind of distant people in my life that were like, "You need to see Dr. Joyce O'Shaughnessy," and of course, I didn't know any oncologist name at that point in my life, let alone her name. And so everybody was like, "You need to see Dr. O," and then everybody was like, "Yeah, you need to see her, but she's really hard to get into. She only sees certain patients, and she I think she really wants to, um, because her roster is full. Let's say it like that,
Hmm.
but I think she has such passion for what she does that when she sees somebody like yourself, that's a triple negative person that really needs the help, and she knows that she's on the front lines of that research and the clinical trials, that she really wants to do all she can to get those folks in and get them help. Because I mean, as you know, you could tell she's super passionate about what she does, and
And smart.
yeah, very smart. And I'm with you. I like the numbers too, especially, when we like take the numbers for triple negative breast cancer or metastatic triple negative breast cancer back, 30 years. It was way worse 30 years ago than it is now. It's made such huge leaps and bounds in progress that it's so good that we have people like that out there working on this stuff.
Hmm.
Yeah. So in this whole process, Amy, has there been something that you're just like, obviously this sucks, this is awful, but this one good thing has come out of it that has really helped me.
I can think of more than one good thing. Um,
That's always fun. I like to hear about it. So tell me, let's hear it.
I am really good at making lists now. There's times that I don't have the energy or sometimes the physical ability to do some things that I need done around my house or, drive or I am really good at organizing what I need done into a list, which is sort of freeing for your mind. You don't keep all that in your head when you make a list.
That's
Um,
why my place and all my desks, I have probably, I'm not even kidding, 20 lists just on this desk, and this is one of like two or three desks. So I feel you there. It is freeing to do that.
You when you have cancer, you do not waste time worrying about what other people think of you. Uh you do what you need to do for you. Like if you've ever hit snooze on a friend on Facebook, no, I know who's my friend now.
That's so true. And you know, you have such a strong support group. You have a special group of friends that you have a Facebook group for that are always pulling for you and cheering you on, and you have like such killer support around you. I see it all the time.
And I'm so appreciative of it. I mean, I'm going through, I'm not married. I don't have any children. My family's very small, so I don't, it's a you experience cancer, it's a burden on the whole family. And it's helped my family out quite a bit to have some very sweet, dedicated friends who are pulling for me and who will literally like one time I couldn't hold down solid food, and my friend that lives nearby came and brought me some soup and brought it warm
That's so
to the
nice.
house.
Yeah, yeah. Here's your soup. We got your soup. Don't worry. They're like banging down the door. We got you covered. We're there. I mean,
Mhm.
and that's just really been how your army has been. Is it's just been super supportive. They can just jump in and help you. I know you've had people come stay with you and just do various things and help you out, and it's been, I know, so good for you. And I'm so excited to hear how well things are going so far with this clinical trial. And we got to keep up with what's going on with you, and we definitely want to have you back on again so you can fill us in and give us the latest updates. Is there anything that you feel like you wanted to cover that we haven't covered that you'd like people to know, or maybe some words of wisdom to newly diagnosed folks out there, maybe with metastatic triple negative breast cancer?
So I don't think I heard you talk much about radiation.
Just a
Um,
tiny bit we did early on, yeah.
that's something that a lot of not everybody does for breast cancer, but that you were asking earlier what was some of the most physically painful or challenging things, and radiation has really been something that I did not expect to be so difficult. They do radiation for breast cancer for all manner of different things, most frequently to the actual area where you had the cancer. Breast cancer triple negative responds really well to radiation, and you don't feel it when it happens. It's months and months later that you're still feeling the effects of what goes on, whether it's swelling of the tissue trying to heal, or regenerating the nerves, or um it's crazy. I should be a superhero with the amount of radiation I've received now. Isn't that how they all got their superpowers?
No doubt, really. Are you still getting radiation now, or is that like
It
in the
just
past?
with metastatic cancer, different things pop up in different ways. So it just depends on how one scan goes, that
Right.
that you get radiation. But the main treatment area, I received 5 weeks of radiation for that, and that is done.
Wow. Man, you're
In fact,
you are a superhero. I just have to throw that in there. Yeah, girl. Yeah. You started to say, in fact, something when I was asking you about.
yeah, I had my 1 year visit with my radiation oncologist, and I'm just now seeing like some hyperpigmentation in my breast area, which looks kind of like spidery purple discoloration. It's just amazing how long the effects of that actually um, show up. So if there's any breast cancer survivor that is going through radiation, talk to your doctor. Don't be afraid. Is this maybe my cancer is coming back, or is this normal? There's just, yeah, there's a lot that pops up with that radiation.
Yeah, I think that that's solid advice in general. Is just any oddities that you might see when you're going through treatment, just bring it up to your doctor just to double check, make sure everything's cool. Always good to try not to panic, but always bring it up. You know, sometimes there might be something that you're going through that is easily treated, that they can take care of some side effect that you're experiencing that might be easily treated. Just bring it up to your oncologist, your doctor, and get their input, and they can help
And
take
if
care of
that
it.
doesn't work, sometimes they have a second plan that, no,
Right.
we can try this instead.
Right, right, totally. I'm gonna give a shout out to a few people, Amy, because there's a lot of people who are sending you some love right now, and I don't want to miss that. So we've got Quentin. He says, "Go, Amy! You are so courageous." Woohoo! Randy Ebert from our Survivors Rock, a breast cancer and stickin community Facebook page. Randy Ebert says, "You rock, Amy." Sarah says, "You are amazing, Amy, Pippi Boyd, so brave and inspiring."
Oh, she's the one that brought the soup.
Oh, very cool, Sarah. Sarah and her soup, Sarah. Woohoo! Quentin says, "Yay! Finally responded to chemo. He's super excited about that." Gayla is here, and she says, "Amy, you are a warrior." Courtney Woods from our Survivors Rock group says, "Keep rocking, Amy." Erica says, "Big hugs." So you're getting lots of love out there, man. And I got to point out one more time, guys, we hit 50 shares, and we have a donor who's going to donate $500. We're at 47 shares. We only need 3 more shares, guys. Let's get those 3 shares in during this broadcast so we can get that $500 donation from that anonymous donor. So please do that. Girl, Amy.
I think you named at least 3 of my friends. I hope they shared it.
Yes, awesome. Yeah, so you guys share it, man. Amy says so. She said share it. Come on. So, Amy, girl, it's so good to see you again. I'm so thankful that we're friends and that, it's a weird way to bond again later down the line, not the way we really wanted to do it, but I'm really glad that we're in all this together. And
we're here for each other.
Yeah, and listen, always text me if you need anything, and hopefully we can have you on the beat again sometime, maybe in the summer, and get another update from you.
I would love to.
Very cool. Well, thank you so much for joining, Amy. We got Jennifer coming next, and we'll see you later, Amy. Take care, girl.
All right, take care.
All right.
Bye.
All right, guys, that was Amy Pippi Boyd, roller derby chick extraordinaire. She's amazing, super strong, tatted up, very cool.